Traumatic brain injury. Traumatic brain injury, TBI, results from an impact to the head that disrupts normal brain function. Traumatic brain injury may affect a person's cognitive abilities, including learning and thinking skills. About traumatic brain injury. The leading causes of TBI that resulted in emergency department visits were falls, being struck by an object, and motor vehicle crashes. Indirect forces that jolt the brain violently within the skull, such as shock waves from battlefield explosions, can also cause traumatic brain injury. In addition, traumatic brain injury can result from bullet wounds or other injuries that penetrate the skull and brain. Doctors classify traumatic brain injury as mild, moderate or severe, depending on whether the injury causes unconsciousness, how long unconsciousness lasts and the severity of symptoms. Although most traumatic brain injuries are classified as mild because they're not life-threatening, even a mild traumatic brain injury can have serious and long-lasting effects. Resulting from an impact to the head that disrupts normal brain function, traumatic brain injury is a threat to cognitive health in two ways. A traumatic brain injury's direct effects, which may be long-lasting or even permanent, can include unconsciousness, inability to recall the traumatic event, confusion, difficulty learning and remembering new information, trouble speaking coherently, unsteadiness, lack of coordination, and problems with vision or hearing. Certain types of traumatic brain injury may increase the risk of developing Alzheimer's or another type of dementia years after the injury takes place. If a head injury occurs, traumatic brain injury injures your brain even if you don't lose consciousness and your symptoms clear up quickly. Anyone who experiences an impact to the head and develops any symptoms of traumatic brain injury should seek medical attention, even if symptoms seem mild. Call emergency services for anyone who's unconscious for more than a minute or two, or who experiences seizures, repeated vomiting or symptoms that seem to worsen as time passes. Seek emergency care for anyone whose head was injured during ejection from a vehicle, who was struck by a vehicle while on foot or who fell from a height of more than 3 feet. Prevalence. According to the Centers for Disease Control and Prevention, CDC, approximately 2.87 million TBI-related emergency department visits, hospitalizations and deaths occurred in 2014, the latest year for which information is available. Causes and risk factors. Preventing traumatic brain injury. Falls are the most common cause of traumatic brain injury, and falling poses an especially serious risk for older adults. According to a CDC special report analyzing data from several federal agencies, each year 56,000 seniors are hospitalized as a result of head injuries sustained in falls and 8,000 die as a result. When a senior sustains a serious traumatic brain injury in a fall, direct effects of the injury may result in long-term cognitive changes, reduced ability to function and changes in emotional health. An estimated 775,000 older adults are living with traumatic brain injury-related disability. Measures to reduce a risk of falls include using a walker or other assistive device to compensate for mobility problems, muscle weakness, or poor balance. Having your vision checked regularly and using glasses or contact lenses that correct for changes. Working with your doctor to watch for medication side effects or interactions among drugs you're taking. Avoiding household hazards, such as clutter, loose rugs or poor lighting. Motor vehicle crashes are another common cause of traumatic brain injury. You can reduce your risk by keeping your vehicle in good repair, following the rules of the road and buckling your seatbelt. You can also protect your head by wearing a helmet and other protective equipment when biking, inline skating, or playing contact sports.